Hey guys, my name is Sharon Hollis, and I wanted to give you a little video kind of explaining what it is I do that I have named muscle function approach. In short, I call it my material science approach to physical therapy. Basically, every material that we work with, let's take for instance glass. You know that glass breaks, glass doesn't bend. Well, as physical therapists, we work with specific tissues, and these tissues have specific properties. Okay? Muscles are predictable. That's one of my slogans, because muscles only do certain things. So it's not guesswork. They either do A, B, C, D, or E. All right, I just made those letters up. Okay, so we're dealing with the muscles. Muscles do certain things. Fascia does certain things. Okay, it's not this infinite number of changes that can happen. It's this, or this. And then the other structure we deal with is the extracellular matrix. Believe it or not, that has a role in tissue function and dysfunction. Okay, so you learn the dysfunctions that can happen to each material, each tissue. And then through empirical evidence, I've gathered the best treatment interventions for each dysfunction. Now, you're taking known materials with known dysfunctions and applying it to a structure that has known anatomy, known biomechanics, known joint arthrokinematics, and it follows the rules of tensegrity. So now you have what I call predictable changes in tissue applied to a structure that also has predictable rules. So in a nutshell, that's what muscle function approach is about. So let me give you some examples. That's a whole mouthful. A good one is me. When I was younger, I was a swimmer. And by the time I was 18, I had had 2 surgeries on my right shoulder for pain. And guys, this was back in the 80s, so they did like a subacromial decompression. Of course, we know that didn't do anything for the problem. So I go to college, I'm in grad school, PT school, and I'm still having trouble with my shoulder, not really able to sleep on it, just, every day, like kind of pain that you kind of deal with. But then on my last rotation in physical therapy school, near the end of that rotation, I went bowling. Okay, let's take an unstable shoulder from years and years and years of swimming, and let's load it with a 12-pound bowling ball and let's roll it down the aisle. Oh my God. I had to leave the rotation early. My shoulder hurt so much. So long story short, I had a near capsular shift. It corrected the instability. I graduated PT school with my arm in a sling. So it took care of most of the pain, except, and I am not making this up, except I was unable to sleep on this shoulder for 20 years. And I'm a side sleeper. I am really not making this up. Every time I'd fall asleep on the shoulder, I would wake up in pain. Here's the kicker. That pain, I was able to eliminate in 3 days. I am not making this up. 3 days. 20 years of pain gone in 3 days. Why? How? Because I learned how muscles work. I learned how one of the materials we work with as therapists, how that material works. I have so many examples, and I'll just give you a few very recent. You know how many articles there are on lateral epicondylitis, and you look at, what do you call it, mega reviews, I forget the term, mega analysis, and nobody really has an answer. Well, maybe we're looking at the wrong thing. Maybe we're missing part of the picture. I've had 3 patients with lateral epicondylitis, lateral elbow pain, which is isolated, right to the radial head. I've had 3 or 4 get better in 4 or 5 visits. I'm just saying, you look at each material. What can go wrong with each material? What are the dysfunctions or pain that can happen from dysfunction in each material? So, as I like to say, it's not guesswork. I look for what the problem is, identify the problem, I know the best solutions, and I apply it within a structure that's predictable. So one of my favorite sayings is we're dealing with predictable materials applied to a predictable structure, which results in predictable problems, dysfunctions. It's kind of a bold statement, but that's kind of where I'm coming from. So there you are. That is muscle function approach. And I hope to see you guys at my first seminar that I am teaching in Greensboro, September 25 and 26. If I do have a higher rate of response or people very interested, I might be able to do a seminar in August. Okay, thank you so much.